Hello. So today we will be discussing about tibia, the medial bone of the leg and the second largest bone of our body. So this is tibia and it is having an upper end, a shaft and a lower end. So this is the upper end. Upper end is having a medial condyle, lateral condyle and a tibial tuberosity. And this is the shaft. The shaft is triangular in cross section. So it is having three borders. And this is the anterior border. This is the medial border. And this is the lateral border. And also it is having three surfaces. Medial surface, lateral surface and a posterior surface. So this is the lower end. And in lower end, we are having a bony prominence called the medial malleolus. So now we can go to the side determination. Hold the tibia in such a way that this broad end is facing upwards and the tibial tuberosity is looking forward and the medial malleolus is facing medially. So with this we can say that it is a left tibia. So now we can see each part of tibia in detail. So first one is the upper end. So it is having a medial condyle, lateral condyle, and in between these two condyles we are having an intercondylar area and a prominence, and it is the tibial tuberosity. So now the medial condyle. The medial condyle is longer than the lateral condyle and is having four surfaces, an anterior surface, superior surface, medial surface and a posterior surface. And the superior surface of the medial condyle is articulating with the medial condyle of the femur. The posterior surface of the medial condyle is having a groove to which the muscle semimembranosus is getting inserted. And the medial and the anterior surface of the medial condyle is having many vascular foramina and also medial collateral ligaments. Now the lateral condyle. Similarly, the lateral condyle is also having four surfaces, a superior surface, anterior surface, lateral surface and a posterior surface. The superior surface of the lateral condyle is articulating with the lateral condyle of the femur and it is covered by lateral meniscus. Its posterior surface is having a circular fibula facet to which the fibula is getting articulated. Just superior to the fibula facet, we can see a groove for popliteus to which the popliteus muscle is getting inserted. In anterior surface, there is a tubercle called Gerdy's tubercle to which the iliotibial tract is getting attached. Now we can talk about the intercondylar area. This intercondylar area is a rough area between the medial and the lateral condyle. And we can see an elevation on the intercondylar area and its middle portion, and it is known as the intercondylar eminence. And these structures are anterior horn of medial meniscus, anterior cruciate ligaments, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligaments. And these can be simply remembered using a mnemonics. Medical College Lucknow, Lucknow Medical College. Now the tibial tuberosity. It is having a triangular shape with bases directing upwards to which the ligamentum patellae is getting attached. Now the shaft of tibia. So this is the anterior border. The anterior border of tibia is also known as the shin of tibia, which is sharp and subcutaneous also. It is extending from the tibial tuberosity to the anterior border of medial malleolus. Now the medial border. It extends from the anterior end of the groove for semimembranosus to the posterior border of medial malleolus. Now the interosseous border or the lateral border. It extends from the fibula facet and it extends towards the lower end, where it is dividing into two limbs and it encloses a triangular area to which the interosseous membrane is getting attached. Now about the surfaces. So first one is the medial surface. The medial surface is between the anterior border and the medial border, which is giving attachment to tibial collateral ligament and also the insertion of sartorius, gracilis and semitendinosus muscle. Next is the lateral surface, which is between the anterior border and the lateral border, from which the tibialis anterior muscle is getting originate. Now the posterior surface, which is between the medial border and the interosseous border. As you can see in the upper portion of the posterior surface, there is having a rough oblique ridge, which is known as the soleal line, from which the soleus muscle is originating. The soleal line is dividing the posterior surface into an upper small triangular area and a lower area also. This upper area is serving as the floor for the popliteal fossa and also the insertion of the popliteus muscle. Now we can see the lower end. The lower end is having 5 surfaces: anterior, posterior, medial, lateral and an inferior one. The lower end is also having a bony prominence called the medial malleolus. In the medial malleolus, we can see a coma-shaped facet for talus. And in the anterior surface, there is a groove for tibialis anterior. In the posterior surface, there is a groove for tibialis posterior. And to the tip of the medial malleolus, it is giving attachment to the deltoid ligament. Now about the clinical relevance of tibia. The tibial fracture is actually common as the bone is subcutaneous and weight bearing. The junction between the distal 1/3 and the middle 1/3 is the common site for fracture. So that's all. Thank you.